This is all my favorite jaw self-care. I recommend doing all these exercises on both sides of your jaw, but for some people, you're really gonna only need to do them on one side, at least when we get into the specific exercises. So what I recommend is testing your range of motion and your jaw function before and after each one, so you can figure out whether some of them you only need to do on one side versus being able to do them on both. I always like to start with the nervous system. So we're gonna start with our trigeminal nerve pathway. This is very, very light self-massage. It's not even really pressure. It's just about the same pressure on your skin as you would use when you're applying lotion or moisturizer or washing your face. So the first spot here is just underneath your eyebrows at this little notch on the bone here. So spend a couple of seconds there, maybe 5 or 10 seconds. You can do little circles if you like, and then you're gonna follow the eyebrow bone out to the temple. And I do each of these pathways 3 times. So that's the first one. Second one is right here where the cheekbone meets the nose. So again, just very, very gentle here, but we're spending some time there. And then also sweeping out to the temple. I do this one 3 times. And then the next one is just to the outside of the nostrils, almost on the bottom of the cheekbone here. So again, spend some time there, little circles if you want, just leave your finger on that spot and then follow the bottom of the cheekbone out towards the ear. So that one 3 times. And then the bottom one, easiest way to find this is to stack your fingers centered in your chin like this and roll to the outside and spend a few seconds there. And then you're gonna follow the top of the jawbone up to the earlobe. So start with your trigeminal nerve pathway. That'll get everything soothed and will get your nervous system paying attention to the work that we're gonna do. Next, I like to do a cheek hook. If you're not comfortable putting your hands inside your mouth, you can use the back of a teaspoon for this. But basically, we're gonna put the finger into the soft tissue of the cheek here. We're not trying to get back to the big, strong muscles. We're just trying to stretch. The sensation we're going for here is also like a stretch, so this shouldn't hurt, but you can give it some good quality sensation that feels effective. I get more sensation if my finger is a little bit more towards the top of my cheek, so I'll do this. And I push out until I feel a nice stretch. I call it a cheek hook, but I usually use my opposite hand and my fingers pretty straight, going into my cheek like that. I do this both sides and I hold it for 90 seconds per side. It is important to hang on to it for a while because we're trying to activate stretch receptors that peak at about 90 seconds. So both sides for that cheek hook. Almost everyone's going to benefit from doing both sides here. The next thing that we want to do is some self-massage for the jaw. So for this one, I would do this typically both sides at the same time. But my jaw is pretty central. So if you find that one side is more effective than the other, you can do just one side at a time. And what you're going to do is get your fingers into the kind of looser skin at the base of the jaw and really slowly drag that skin upwards. We're trying to kind of take as much of the skin with us as we can in this. I stop here below the cheekbone and I'll do a couple of times just opening and closing my mouth. You might get a little bit more stretch when you open the mouth. So I'll do that 2 or 3 times and then still trying to drag the skin with me. I come up above the cheekbone and same thing here. I'll open and close a couple times here. And you can hold that open for as long as it feels nice to you. And then I'm going to come up through the temples and actually grab the hair and pull that upwards. And again, here I'll open and close the mouth a couple of times. You can take as long as you want to do that. I recommend at least a minute to get from your starting point all the way up to the top. And the hair pull is just taking the hair and getting that skin stretching across the top of this muscle here, temporalis. If you don't love the feeling of that, that's okay. You can just go with a flat hand kind of up to the top of the hairline there, the scalp, and then do that same stretch by opening the mouth. If it feels nice to hold the mouth open for a while, feel free to do that. So that's our next one, a little bit of self-massage. I'll do specific exercises for the jaw depending on which side I feel like needs this particular work. But for yourself, you can try both sides and see which one feels better. So first of all, we're going to open the jaw against resistance. We're trying for an isometric exercise here, so we're not moving the jaw very much. And so we're just meeting the force. It's not a lot of force either. I start with about 20% of how hard I think I could do this. So I've got my thumb or even my whole hand underneath my jaw, and I'm gonna open my mouth to push my bottom jaw down into my hands. So I'm opening, I'm stopping myself from opening, so the force from my jaw going down is met by the force by my hand coming up. I'm using about 20% of my force. I take about 3 seconds to slowly build that up, that tension, and then I hang on to it for about 10 seconds and then slowly let it go. So that's our first one. That's depression of the jaw. I'll also try and go side to side. So this can be a difficult movement for people if you're not used to this, but your jaw can go, when it's open, to the left or the right. I realize that's mirrored here, but my left or my right. So we can do that with resistance as well. So you would open your jaw a little bit and then have your hand on the side of your jawbone. And again, we're gonna meet that force. So I'm trying to push my jaw this way while my hand stops that from happening. So with a little bit of opening. And just like the other one, I would slowly build up pressure for about 3 seconds, hang on to it for about 10 seconds, and then slowly let it go. And I would do that to both sides. So the other side just looks the same. Open the mouth a little bit. So I'm pushing that way with my jaw, stopping myself from moving with my hand. These ones especially can be effective if your jaw deviates side to side. So if when you open your jaw, you get this wobble going like that at the end, or maybe it goes kind of like an S curve through there, one side or the other is probably going to be more helpful. So do this in the mirror, watch yourself, try one side. If it's straighter after that one side, awesome. Try the other side just to be sure, but you might go, okay, when I do this on the left, that makes more difference than when I do it on the right. Perfect. You could just do it on the left, but you're going to self-evaluate every time to make sure that you're actually getting the change that you want. One of my favorite stretches for the muscles below the jaw and down across the front of the neck is to hang on to the skin right above the collarbone. So if I'm stretching this side, I'm going to hang on to the skin here at the collarbone. I'm going to rotate my head away and slowly bring my chin up. This can be very intense if you go too fast. It can feel almost like tearing or burning through here. So we do this slowly. You can get some pretty good sensation here, but again, this shouldn't hurt. If we're really trying to get a difference with stretches, we want to hang on to them for a while. So I would hang on to this one for 90 seconds as well. And then I'm going to come back again, nice and slow, and then reevaluate my jaw function. Does it feel better? Is it moving smoother? Is that click gone? Or, is the jaw moving straighter than it used to? So that stretch and these side to side jaw isometric exercises can really work to strengthen the jaw. What you might find is that the isometric to the left and the stretch to the right complement one another and make the most difference. So be aware that you might have one on one side and one on the other side. Okay, lastly, jaw centralization exercise that I really like is to bring the tip of your tongue to the hard palate, so just behind your top teeth. So the tip of my tongue is going to touch just there behind my top teeth. And then I'm going to curl my tongue backwards so that I'm going all the way back to my soft palate. So the tongue is going to move across the top of the roof of the mouth until the tip of the tongue, it's the bottom of the tip of my tongue, is going to be touching my soft palate. And then at that point, I'm going to open my mouth just enough for the tongue to start to pull away from the palate, and then close it again and watch for how central the jaw moves. So for me, my jaw is pretty centered. So usually for me, if my tongue is centered in my mouth, my jaw is going to move straight. This doesn't look like much, but I'll show you. So tongue to the hard palate and then curled back to the soft palate. Can't talk while I'm doing that. And then opened. So I'm trying to pay attention to how smooth that is. So I'll do that in the mirror, watch and see how it is. If your tongue is centered and your jaw is deviating side to side, then you move your tongue to one side or the other to find the spot where your tongue is that the jaw moves the most central. So for me, that's centered tongue, centered jaw, and that's actually our goal. But watch what happens if I move my tongue all the way over to the side. So I'm going to be touching my back molars on this side, and watch what happens to my jaw. So when I fully open my jaw and my tongue's over on this side, my jaw also deviates to that side. So watch yourself in the mirror, find the spot that you can put your tongue at that soft palate side to side that keeps your jaw moving as centered as possible. Do that every day. Do about 8 reps. If you do it every time you brush your teeth, this will be a great habit. They're tied together. And then watch for that to start to change. So let's say that for you, your jaw moves centered when your tongue is over on this side. Maybe after about a week or so, you might notice that with your tongue in the same position, the jaw is starting to move as well. Once you see that starting to happen, you find a new position for your tongue and you do that. So jaw centered, wherever the tongue is. And then we just keep reevaluating with our goal is to get your tongue centered and your jaw centered. But that exercise, I really like to train the jaw how to move properly or normally again. So those are my favorites for jaw work. This is what I advise most of my clients to do. I'm going to be a lot more particular and precise with clients because I've done an assessment with them, and I can help guide them to which one is going to work better for them particularly. But if you're just watching this online and you want to just try some of those exercises, please remember to evaluate your function before and after. For some of you, it's just what makes my jaw feel better. For other people, you're going to have something really objective to watch, like how straight is my jaw or how aggressive does that click or that clunk feel. Please feel free to send me any questions, and I hope this works to reduce your jaw tension, reduce the pain that you're getting, and get that jaw moving normally.